My name is Sean Koppe. I'm Associate Professor of Medicine, and I'm the Network Director of Transplant Hepatology here at Northwestern. My primary focus is doing a lot of outreach clinics and trying to expand the reach and the access of Northwestern to patients in the community. Northwestern Transplant Hepatology has 17 locations with off-site clinics, and some of these locations actually have multiple clinics in a given month as well. Our off-site clinics are located throughout the Chicagoland area and Northwest Indiana, so we try to serve as large of a geographic area as we possibly can. We have multiple clinics in Southwest Suburbs, at Orland Park. We have clinics farther south in downstate Illinois that serves our central and southern Illinois population. And then we have multiple clinics in the western suburbs, and we also have multiple clinics in the north and northwest area of the state as well, reaching as far out as Rockford and also Grayslake. The purpose of having so many off-site clinics is to bring high-level transplant care closer to where patients live and to fulfill the vision of Northwestern Medicine, which is to be a premier integrated academic health system, bringing the best in medicine to a growing number of patients closer to where they work and live. For the transplant program, compassion, ingenuity, and accessibility are high priorities as well. We strive to provide the right care at the right place at the right time. What makes the Northwestern Transplant Outreach Program unique is the breadth of our coverage. We're still also set up in a way to collaborate with referring providers so patients can get much of their care locally with the referring doctors, whether it's endoscopies or imaging or paracentesis. What helps make our liver transplant program stand out is our experience. We're one of the highest volumes transplant centers in the country. And we have an incredibly talented group of surgeons, as well as talented transplant hepatologists, and also interventional radiologists and other ancillary services available like cardiology that helps us to care for patients with very complex needs. Northwestern really brings with it a lot of expertise, and I think in addition to that is sort of coupled with a desire to be as responsive as we possibly can, both to the referring doctors as well as to the patients themselves. So we strive to provide excellent clinical care, but also hopefully couple it with a desire to communicate well with the referring doctors, et cetera. When patients are referred to the Northwestern Liver Transplant Program, you can be confident that they're going to be getting the highest level care possible by highly experienced providers.
My name is Dr. Laura Kulik. I am a transplant hepatologist at Northwestern Medicine. My area of focus is in treating patients with underlying liver cancer, as well as patients who are awaiting transplantation. The Central DuPage Hospital Liver Hub is going to be unique and different from our other satellite clinics by two different reasons. One is we are going to have a greater number of physicians who will be staffing our outpatient clinic. There will be a total of 4 physicians who will be rotating. We'll have more than 1 clinic per week. And also we are going to have a dedicated inpatient unit that is staffed by transplant hepatologists to serve our patients who have complex liver disease, including patients who are being worked up for pre-transplant and those who are hospitalized post-transplant. Currently, the outpatient center is running. We are having our physicians there at least once a week, and we will be building that to have clinics at least 2 to 3 times per week. And the inpatient center is going to be opening on January of 2023. We're very excited about that. This liver center, I think, will be very instrumental in benefiting patients because we will now have another area where patients will not have to come all the way downtown to start their workup for liver transplantation. We are hoping that as this CDH hub grows, that we will be able to incorporate research trials for our patients there as well. There are services that are going to be available at the CDH Hub that I'm very excited about. I think they will be very helpful for our patients, and this includes a behavioral institution. This is both inpatient as well as outpatient services. We do know that alcohol-induced liver disease is on the rise, particularly amongst women and in our younger patients, and this will allow access for these patients to get the care that they very much need. I think that this starting the CDH Hub is just the beginning. It's showing the dedication that Northwestern has to our outreach program that's being led by Dr. Sean Koppe. It is going to allow us to give a broader reach to our patients who so badly need dedicated liver disease care.